Systems are a very unique animal, right? They are not necessarily fit into the common way of managing healthcare delivery systems, right? I'm talking about the financial side of it. Quality-wise, patient safety, experience, we need to do exactly the same. In fact, we need to do better. But on the financial side, the reason is because all the hospitals have got a mission, and the mission is to provide care for people who are not able to pay for it. They are uninsured and also uninsurable, because Affordable Care Act has created a new, all the positive things that happen. I'm one of the biggest proponent of, and supporter of this Affordable Care Act. But it did leave behind a good portion of people who are the undocumented immigrants in this country who are uninsurable. So the public hospital basically takes care of them. There must be a mechanism, financial mechanism, to take care of these people over a period of time. So the Affordable Care Act actually gives an opportunity to insure more people, but also it creates a segment of people who will definitely will not be insurable or uninsured or underinsured. And then there is a group of people who are called young invincibles. These are young people who are invincible, who don't want to take health insurance because they think that they are so strong, they never require hospitalization. God bless them. And they will be uninsured at the end of the day, right? So public hospital basically takes care of all these people. So the amount of money, the financial way to do that is being a consistent issue, right? So there's no public hospital system right now in the country, for example, for a long period of time, but never in black. There's always a structural deficit because of a section of people you can't collect money from. So, but the Affordable Care Act, right, and the waivers which come with that is going to give an opportunity for us, because the federal government is basically investing $8 billion in the healthcare transformation of New York State. And more than $6 billion of that will be in the healthcare delivery system reforms. So this gives an opportunity for us to be an active leading player in the market, because what they want us to do is what we have done well in the past. In fact, when it was not very profitable or even kind of sexy to do primary care, preventive care, and community-based care, all those things were really not service lines which are profitable for most of the hospital leaders. But the health and hospital always was in public care. It's always in a community-based care. It always was in preventive care and a primary care. So ACA and the waiver actually helps us to promote those things. And future of the payment reform will help us to put health and hospital in a much better system. But having said that, there will be a structural deficit. The city basically contributes a lot of money to health and hospital to do that, to take care of the New York City residents. And we need to also find out from the state and the federal government should continue to subsidize, right, the care of the people who cannot be done. The reason being, there is a false idea in our country. People believe that, the uninsured or uninsurable people's health care is basically free. No health care in the city is free. All of us are paying for it, right? We pay through our taxes. The money is not, when you give a care to uninsured people, right, it's not just coming out of nothing. There is expenditure, and of course the government in some way pays for it. And the government pays for it because they collect taxes from you and me, and then they pay for it. So in one way or another, you're contributing to it, right, as a part of it. So it is better that you contribute smartly by connecting those people to healthcare upfront, so that the cost will be minimal, as opposed to paying for it at the end of the care, because they denied insurance, they get sicker, they end up in the hospitalization, and then you're going to pay for it, right? So there is nothing called real charity care. One way or another, the taxpayers of this country pay for it. So I think that is the future. So that's why I believe that both city, state, and the federal government need to take that into consideration and fund some of these areas so that we are able to be structurally and financially sustainable system.
Now, you're returning to HHC after a 2-year stint in a similar role in Cook County, overseeing the Chicago public health system. Now, I'm curious, as you return now to HHC, have you identified certain areas in the system that are kind of ripe for growth? Obviously, you had started a kind of a similar health plan to the Metro Health Plus that we have here, and which we'll talk about in a second. But are there other areas within the system, whether it's around patient care or delivery of service, where you think there are some room for investment?
The future healthcare system wants us to grow in certain areas and not to grow in certain areas. And that's exactly what we did in Chicago, Cook County, and that's what we are planning to do here. The future is not about any more profitable service lines. It is about providing geographically convenient access to people. So that is the area of growth for Health and Hospital Corporation. So the hospital system, which has so much inpatient focused for so many decades, needs to really figure out how to get out of the inpatient focused systems into an outpatient community focused system, right? That's where the growth is. And that's where we are going to grow our system. And that is where it is going to be helpful to the communities. That is where it's going to create a healthy nation. Let's be perfectly candid with ourselves and honest with ourselves. We never really had, healthcare system is a misnomer because we never had healthcare in this country. We always paid for sick care, right? People got sicker, everybody made more money. It's a hospital, doctors, whoever it is. So we paid for sick care. So there's no incentive for anybody to keep anybody healthy because healthy patients are not really good business model, right? The sicker the patient got, it is better. And there was never a system, right? It was fragmented. So when you call healthcare system, there's no healthcare. It's actually sick care fragmentation, right? That's the way we have developed that. But the Affordable Care Act, for the first time, gives us an opportunity to really create a healthcare system, right? And that is an area where Health and Hospital Corporation excels, and that's what we know how to do better, and that's where we're going to develop our future.
Now, specifically talking about the Metro Health Plus plan, it's for those of you who don't know, it's the kind of the government, this New York City plan that the government offers or the government administers. Give us a kind of a state of Metro Health, and I guess we talked a little bit about just before the 4P plan. If you could detail that as it relates to Metro Health as well.
Metro Plus is one of our health plan. That is one of our subsidiary of Health and Hospital Corporation. In my previous stint in Health and Hospitals, Metro Plus were reporting to me, and we started growing Metro Plus. We grown Metro Plus purely at the time as a Medicaid health plan, right? So today we have about 470,000 enrollees in the Metro Plus health plan. And today Metro Plus health plan, not only Medicaid, it has got a Medicare Advantage, it has got a Medicare fee-for-service, it has got a commercial plan, and is also a very popular plan in the health exchange. In fact, that is health in Metro Plus netted close to 90,000 new enrollees last year in the health exchange, which is by far the largest number of people enrolled in a plan in New York State is Metro Plus. So Metro Plus is becoming stronger and stronger as an organization. The reason why Metro Plus is so important to us is because the future of Health and Hospital Corporation is talking about getting a market share. At the present time, our market share is 16% of New York City, right? 1 out of every 6 New Yorker is a patient of New York City Health and Hospitals Corporation. We want to make it 1 in 4, right? 25% of market share. So to do that, we have to do 2 things. One, we need to retain the patient within our system because we do a great quality and we have some of the superb doctors, but our issue we need to deal with is a patient experience component. The patient need to feel experience, need to be better if they want to continue with us. That's one thing. And second thing is we need to bring in more patients into the system, and Metro Plus will be the conduit through which we bring a lot more patients into the system. and then we need to make the experience better so we retain them. So Metro Plus will be an essential part of Health and Hospital Corporation. And this strategy is nothing new, right? In Cook County, we started, when I got the waiver, federal waiver, which is one of the first federal waivers to expand Medicaid, even before the ACA became a law of the land, we enrolled more than 150,000 people in Cook County into this plan. The idea was this, right? Healthcare delivery system is fragmented, right? We all agree. So is the healthcare administrative system, right? We have a Medicare, then we have a Medicaid. Both are government plans, right? They have establishment, administrative structure for Medicare. Then we have big administrative structure for Medicaid in this country. Then we have commercial plans. Then there are third-party payers. So this is like a tremendous amount of administrative overload which into that. So question was, if we really want to have not a fragmented healthcare system, delivery system, why would we not have a fragmented healthcare management system or administrative system, right? So with that in mind, we said we were going to be, Cook County Health System will be what we call the 4P. We will be the provider of care. That's what we've done a lot of times. We also want to be health plan, which is like Metro Plus, we have county care. We're also a payer because municipal governments are the biggest healthcare payers because they pay for the healthcare for their employees. In Cook County, between the pensioners and employees, Cook County government pays close to $300 million every year to a Blue Cross Blue Shield of Illinois. So the governments never really leverage their payer status to the effectively. So we always said, why do you want to give them to them? Why can't you give it to a government-based county care, which is your plan, and we'll be able to offer you better care, right? That is a payer. The last one is a population manager, because at the present time, we hire population managers to manage population health. So the future healthcare system we envisioned was that one system will be provider, it'll also have a plan, it'll also have a payer, and it'll also be a population manager. That is a 4P plan, we did that. That created a lot of issues because that completely knocks off a large portion of real people in the thing, because there is an industry which is providing health plans, and there is an industry which is payer collaborations and cooperatives which does that. Then there's a provider system, and there is a plethora of consultants who are providing population health management. So if you bring everybody together, we collapse administrative cost, and we can have more dollars reach the patient as opposed to coming through the various sectors. It is nothing new. That's exactly what we wanted to do in New York City, because we want to create something like a Kaiser Permanente model in East Coast, which has got three components. One is the plan, and then next one is a provider system, which is our hospital integrated delivery system. Then we have our doctors, Kaiser docs, right? So Health and Hospital has got its own docs. So that is the future of the organization. In the fragmentation that people are really, working with the insurance companies, negotiating rates, and you get a better rate, and you don't get a better rate, and doing this. It is a big industry which basically which teaches you and helps you to negotiate better with the insurance companies. If you are the insurance company for yourself, then all those things will go away. So I think we need to look at healthcare very differently. The fragmented healthcare has got to get better. So is administrative fragmentation has got to get better. So I know it's not going to be very popular, so probably, but there's something we need to get it done.
Now, when you were in your previous stint at HHC, and also when you were at Cook County, you implemented a cost-cutting program, or helped implement a cost-cutting program. Now, I'm curious, now that you're back at HHC, can you apply some of the same principles to those cost-cutting plans in Chicago as you did here? Are there areas where you can find similar efficiencies, either in healthcare delivery or patient care, and if so, where are those areas?
Instead of calling it a cost cutting, I will think that you make a system more productive. If you make a system more productive, the cost comes down, because when there is a wastage in the system, we need to take it out. And then if the system is more productive, then the cost of giving care will become. There's a fixed cost in everyone. So if you're able to provide more care for that fixed cost, naturally you become more cost effective. So the common ways which we always do them is we always leverage the size of the corporation to find a better contract, better management of the contract, and then making sure the deliverables are there, right? It's not only getting a better contract, you also have to manage it better. So better vendor management, the ability to generate the information we need, do a cost comparison amongst people. And then there is a standardization of the various medical equipments so that we don't have 5 different companies providing 5 different equipment to somebody else. That becomes an issue. And cutting down the waste and making sure that we have a just-in-time inventory management system where we are just manage inventory. We don't keep too much inventory in our ORs and in our cath labs and in our EDs and ICUs. So we make sure the on-time inventory delivery system. So those are some of the areas where we do that. And the second part of productivity is we have to really make our workforce more productive. We need to do is to make sure that people work on the top of the license. If the nurse or a doctor is going to be wasting time and doing non-doctor, non-nursing functions, that is a loss of productivity at a various levels. So we have to really figure this out, how to do that. So what we have done was we've taken the Toyota production system. It's called Lean for the sake of, because Lean has got a bad connotation. So we made it into breakthrough. And basically it is an employee empowerment system to be more productive. So we have done that very, very well in the Health and Hospital Corporation. We have been into our 7th year of this breakthrough journey, where the frontline people come together and kind of come out and say, this is the way we can improve, we can cut the waiting time by half an hour, or we can make the process move faster. The call can be answered in 16 seconds, right, from 25 seconds, whatever need to be. So we are extensively employing that particular breakthrough improvement system to get the frontline people to figure out how to make them more productive. So the cost cutting has got this connotation, say that somehow immediate cost cutting means we are going to fire people. But cost cutting simply means that making your people work effectively and more productively is a better methodology, able to get that done. So I think any system not necessarily need to understand that it has got to be more productive. If you have a productive system, then you eliminate waste. If you eliminate waste, then you save costs.